So many of the dental sleep medicine providers that Dental Sleep Profits works with also manage a dental practice with sleep as an adjunct. So how do you know when to actually pursue marketing directly to the public and bringing patients in from the public? It has to be after you have successfully established a screening protocol in your office for your dental patients. We like to see offices do 3 to 5 deliveries before working with us, just so you know what type of hurdles and obstacles to expect with a patient. But I want to give you a baseline for what success means with your screening protocol in the office for your dental patients. And this comes from Brett Brocky over at Nexus Dental Systems. Screened over 10,000 patients, had an incredible success rate with that. And he teaches that you should be seeing a 10-3-1 ratio. That means for every 10 patients that you screen, 3 are going to pop for signs and symptoms of OSA, and 1 of them should be moving forward. So if you're not getting a minimum of 1 patient moving forward with treatment for every 3 that display signs or symptoms, then you need to look at your internal processes to determine why that is. And once you get better, you'll start increasing that ratio. You'll see a 10-5-2 or 10-4-3, something along those lines. You want to make that ratio better and better. That's how you're going to know it's time to start marketing to the public, when you have your systems in the office efficient and working well.